Hello everybody, I'm Deborah Severo, a physiotherapist and an animal osteopath. I work as a freelancer and in my daily practice I mainly got the chance to work with dogs and cats, but also horses, donkeys, and sometimes also with pigs. I have almost 20 years of experience by now using K-laser devices. And I can tell you that K-Laser is not only a fabulous device to solve musculoskeletal issues, but also wounds, mouth problems, and it is also in neurological pathologies and in many other fields. So in this case report, you will see my personal experience with a last an 11 years old Shih Tzu. Then in just 2 days became paralyzed. Spinal reflexes were all absent. Flexors from C6 to T1 and flexors from L7 to S1 and patellar flexors, both on left and right side. Unfortunately, it has not been possible to take an MRI scan due to the severe heart problems of the little dog. For this reason, we do not have a real diagnosis, but it is hypothesized a polyneuropathy of infection or inflammation metabolic order. So the dog arrives to my studio after doing several months of classical physiotherapy, where he had only managed to recover the movement of his head. I have to be honest, I was very doubtful about the success of this case. First of all, because I did not have a diagnosis, and because the situation was very serious. But Last and his owner had no other options. So I accepted the challenge, while honestly telling them that I did not know what the final outcome of the therapy we were about to begin was. So I treated Last with K laser cube performance. And I can hardly believe to my eyes when the dog, right after the first session, still in my studio, started to crawl over when normally he could only stay on his side and had the owner move him on the other side. I was totally surprised and the owner started to cry. And what comes next is absolutely incredible because the dog from quadriplegia recovers completely, as if he had awakened from a nightmare. I still cannot believe it because he recovers so fast since we started K-laser protocol. In just 5 sessions, he could stand up and then very fastly walking and running again. K-Laser Cube Performance 30 was found to be an excellent therapeutic effect on an acute onset of unknown nature of polyneuropathy, with consequences were leading to a severe flaccid paralysis of all four limbs and to the inability to support the head. I can proudly say that we returned the smile to Last's owner and we gave many more happy years to come to little Shih Tzu Last. So now enjoy the viewing. So let me introduce you Last, an 11-year-old neutered male Shih Tzu. And this is a picture taken the first day he came to my studio. And these are the results of the exams taken on the little dog, where all spinal reflexes were absent. So the diagnosis was a polyneuropathy of nature to be determined, infection or inflammation metabolic order. So at the neurological examination, the dog showed flaccid tetraparesis without back pain. The dog showed an acute onset, so inability to walk on four limbs. 2 days before complete paralysis, walking was difficult on back hind limbs, and then from the next day, also on four limbs, with inability to get up. As you can see, on an acute onset, the dog wasn't able to support his head, with suffering also of cystitis caused by catheterization. So little by little, in more than a month, he can support a little bit his head and he starts to drink by himself. The owner perform these exercises every day, twice a day, trying to stimulate a movement. No other therapy were taken. The little patient was not an easy one because he doesn't like a lot of food, so it was quite difficult to stimulate him. At the beginning, the dog was catheterized and the feces extracted manually. Then also the urination stimulated manually once the catheter was removed. Unfortunately, a complication of using the catheter was cystitis that I treated with K-laser using the protocol musculoskeletal hind limbs cystitis. 1,782 joule have been applied using the therapeutic Zoom. 2 sessions per week for a total of 6 sessions. The peak power was 30 watt and the average was 20 watt. Total treatment time was 2 minutes and 26 seconds. The area treated was the pelvic region. Unfortunately, I was unable to film this treatment because the animal was not very cooperative and tried to bite the owner too. This is last immediately after the first session, and he is already completely different from when he entered the studio the first time. He is more cheerful and eager to interact with me. And here you can see how I performed the treatment on the little dog. These shots date back to the last treatments made because, as you can see, the dog is already able to stand up upright. Not having a precise diagnosis, I decided to treat the whole column in order to give an input to the whole spine and its nervous system. In this case, I move the handpiece through the fur, trying to reach the skin. I treat the paravertebral muscles and I go over the spinosus processes as well. As at the beginning, the dog presented a flaccid paralysis without pain. My manual skills were the same as you are now watching. In other cases, you have seen me hold the handpiece 1 centimeter away from the skin because the dog felt a lot of pain. But in this case, the pain was not present. I used K-laser tube performance and the protocol was edema and congestion on the additional programs for a total joule of 2,400 with a therapeutic Zoom handpiece. 2 sessions per week were applied in the first week of treatment with peak power 30 watt and average power 20 watt for a total time of 2 minutes and 18 seconds. In the second week of treatment, I used lumbosacral spinal cord trauma. Using 2,565 total joule with a peak power of 30 watt and an average power of 20 watt with 1 minute and 39 seconds total time treatment. So when last entered the first time into my studio, he was listless and depressed and could barely support his head, and he was without the control of urination and defecation. The amazing thing of this case is the speed with which the results arrived, virtually immediate. Right after the first session, he started to roll on the ground, trying to roll over. And after the third session, he rolled on the ground and got the belly in air, thing that he had never done before, and is starting to move the tail and have a better control of head and neck and starting to have shoulders control. So that's him after the first session at home doing his exercises, and you can see that now he's able to have a better control of the trunk and the shoulders, and he starts to wave the tail, as you can see, and he's willing to reach the food, while before he was not. And he tries to move his front limbs to reach the food as well. And this is after only 9 days. And here, after 2 days, back at my studio, you can see he can wave his tail, he supports his head, and he's happy now. He's curious, he wants to interact, he wants to move, he wants to sniff around, and he tries to roll over, and you can see there's a little movement in the hind limbs. He starts to stand up at home while eating. Here, of course, the owner helps him a little bit, and it's a little bit difficult being outside, and also he starts to be tired as well. But at home, it starts to stand up while eating, and you see it's only 3-4 days. That's back at the studio. And finally, on the 17th of September, it starts to walk. And this is the 21st of September, back at my studio. And you see that he walks quite good, and he's comfortable, of course a little bit unsure in the back limb, but he is comfortable, and he's recovering his life. He moves freely and with autonomy. He manages to fulfill his needs, and he starts taking small walks as well. And this is last today, so back to a normal life finally.